webinar is going to be, and you will all have heard that we are now recording. I hope you're okay with that. Today we have the pleasure of learning about ethics from 3 organizations that have a special focus on and expertise in assessing ethics related to social interventionist assessments. So without further ado, I will give the word to Karin Ramsay. Please go ahead, Karin.
Thank you, Rigmor. I'm Karin Wilbe Ramsay from SBU, and I work as a project manager here. I'm not a professional ethicist, but I have been involved specifically in giving advice to other projects on ethical matters. And I have two colleagues with me here. Karin, would you say introduce yourself? Or
yes, thank you, Karin. So I'm Karin. I'm from INESSS, Quebec, Canada. I am an ethicist, and I work as a scientific coordinator in the ethics and methodology office at INESSS.
Thank you. And we also have Leah here. Can you
Hello,
just say
everyone.
hi? Hello, Leah.
I'm Leah. I'm a scientific project manager at French National Authority for Health. And thank you to have me.
Yes, thank you from me too. And we will share a presentation today. And I think that Karin will start to share the presentation. I can also say that we will also include some Mentimeter questions, but not. You will see. You will hear from that. Okay. So please, Karin, I think that you should start. We will share these presentations. We will switch presenters a few times.
Yes.
Yeah.
So thank you very much for having us today. We're trying something. We tried to work this presentation together. So hopefully this will be fluid for everyone. So let's start. We wanted to answer a few questions. And the first question we are addressing is, what can ethics bring to social intervention assessment? Thank you. We had some people introducing themselves in our presentation. So in terms of what ethics can do is bring a principles-based approach to our assessment. And this can allow us aim for procedural legitimacy of the assessments that we are undertaking, notably by providing us a way of having making sure that we have a fair process that is relevant to the intervention that we are looking at, that is transparent in the way we do the assessment, that we are open to revise, and also that we have the means to enforce this process throughout different assessment activities. Also, in terms of engaging participants, including the right perspectives around the table, making sure that we have diversity and that we manage or balance the conflict of interest that can be around the table. It also allows us to aim for substantive legitimacy concerning the specific interventions that we're looking at. So do they have specific social goals? Can this bring global value to the intervention that we're assessing? Are we using the relevant knowledge? Can that allow us to have the different worldviews integrated in our work? Do we use relevant criteria and evidence that can help us shed light on the ethical considerations that are implicated, and that allow also to weigh and balance ethical considerations when we do the deliberations and we formulate our recommendations, and also allowing to aim for responsible innovation being integrated in the system, recognizing and reducing the burden of influence of social determinants of health, and also aiming for eco-responsibility, so reducing environmental impacts of our work. I'll pass it to Leah.
Thank you, Catherine. So when ethics is relevant, ethical issues come up at every stage of our work. From the moment we design an assessment, we need to think ethically. Is the tool appropriate? Are we asking respectful questions? Then during data collection, especially with vulnerable groups, we must be careful with consent and confidentiality. And even when we publish a result, we need to make sure we don't expose people or misrepresent their realities. Ethics also matter when we collaborate internationally, since expectation and norm may vary. So I think it's Karin then for the why.
Thank you. I will try to answer the question, why is ethics important in social services interventions assessment? And the simple answer to this question is that ethical considerations are needed for better and more comprehensive decision-making, including guidelines and recommendations. And I have borrowed this picture from the evidence to decision frameworks, since I think it illustrates this quite nicely, regardless if you use the evidence to decision framework or if you use another model for decision making. And you don't have to care about all the details in this picture, but in social intervention assessment, or HTA, you typically evaluate effects of interventions through a systematic review of published research, which is illustrated in the left part of this picture. And ideally, ethical aspects should be considered and integrated in that systematic review. But the aspects that are not incorporated or not possible to evaluate in the systematic review need to be considered somehow anyway in the decision-making process, which is illustrated in the right part of the picture. Maybe you can click, Catherine. I think one. No, only one. Yes. So it's highlighted there in the right picture where ethical values come in the decision-making process. So we can make decision makers and professionals to make wise decisions by pointing at ethical dilemmas and aspects that need to be considered when using the specific intervention and when making choices between interventions. Thank you. Next slide, please. So with those questions, we will soon try to ask how you can do this, how you can integrate ethical aspects in social intervention assessment. But first, we would like to ask you a Mentimeter question. So if you have a mobile phone at your hand or ready at hand, or I think that you also can use ordinary web to try to go to www.mentimeter.com. I will share, sorry, my, here. So, I'm not used to Zoom, to sharing, but do you see my screen? I will, and do you see the code? Have you managed to enter the code? I don't see.
Yes.
It's
Yes.
working.
Okay, great.
Thank you.
So the question here is, the first question is, how familiar are you with ethical aspects in social interventions assessment? And you can rate your experience and ability. You have some options here, and I hope you find some option that maybe fits in on you. And it's totally anonymous. Great, we have some replies. Eleven replies. Okay. Maybe all, where we have some more people that are still replying. Yeah. Thank you so much for participating into this. And we can see that most of the people here seem to have some more good knowledge in ethics, but have not used it so much within social interventions assessment. And we have also some people that have good experience and have practiced it, and also some, that have replied, yes, that they have applied it a little bit, maybe. Great. Thank you. And we will have two more questions, Mentimeter questions in the end, but this was just the first question to get you a bit active in the beginning and see how you rate your knowledge and experience in this. So now we will continue again with the presentation. So Catherine, if you can share, please. Thank you. And we will now try to answer the question, how are ethical aspects integrated in social services intervention assessment, by giving examples from the agencies that we presenters work at. And Leah will start to tell us a little about how they do it in HAS. Please, Leah.
Thank you, Karin. So the French National Authority for Health, also called HS, is an independent public authority that aims to improve the quality of both healthcare and social care services. One of its key departments is the Quality of Social Care Department, which works in three main areas. An assessment unit responsible for assessing social care, a recommendation unit which develop best practice guidelines, and a specific mission focused on method and tools for social care support. Next slide, please. The HS does not work alone. It forms working groups that bring together field professionals, service users, and researchers. But also we can conduct interviews. These groups meet to share their experience, scientific knowledge, and practical insights. The principal goal is to co-develop recommendations, methods, and tools that are realistic, evidence-based, and adapted to real-world settings. This approach encourages participatory involvement, more legitimacy and acceptance of the recommendation, method, and tools, and of course, a better uptake and ownership of those one. So next slide, we'll talk about assessment unit. In France, we use the HS quality framework for social services to assess social services. This framework is person-centered and promotes 4 key principles: self-determination, respect on fundamental rights, inclusive approach to support, and an ethical knowledge for professionals. In the assessment process, these principles are reflected in specific evaluation criteria, such as listening to the views of the supported person about respectful care, encouraging professionals to participate in ethical reflection, and ensuring that each organization implements a strategy for respectful and ethical care. In addition, the results of the assessment are published for greater transparency. So I think there is a slide for... Thank you. So the assessment unit is not just about measuring or checking compliance. It's about creating a process that listens, values, and supports people. assessment becomes meaningful when it's reinforced dignity, autonomy, and inclusion. In this way, the assessment unit is a driver of quality and a safeguard for ethical and respectful care. So yes, this slide is for recommendation unit. The recommendation unit develop best practice guidelines in which ethics is always integrated. First, every recommendation is grounded in respect for human dignity, individual autonomy, and fundamental rights. They are also person-centered. The focus is always on the needs, rights, and aspirations of the people being supported. It promotes empowerment and participations. People are also encouraged to take part in shared decision-making, to express their views, and to have a genuine voice in shaping the support they receive. It also guides the professional's attitude. That means encouraging transparency in decisions, fostering a sense of responsibility, and promoting a reflective practice so that professionals can constantly question and improve their actions. Finally, it's about continuous improvement. Ethical reflection is not just a one-off exercise. It is a constant process that helps us to question existing practice, prevent risk, and steadily improve the quality of care and support. So in every practice guideline, ethics is a foundation that gives meaning and direction to good practice. And then there is the mission. Thank you. The mission, method, and tools for social and medical social support as a multi-annual work program. It focuses on collecting and valuing the perspectives of the individuals supported by social care services. This work program provides ethical guidance. This includes key concepts such as epistemic justice, which means recognizing that the knowledge and experience of users are legitimate and deserve to be heard alongside professional expertise. Another important dimension is fostering ethical reflexivity. Professionals are encouraged to reflect on power dynamics, to be aware of their own biases, and to think about inclusion in their everyday practice. These insights directly reinforce quality of social care. They help to improve the way support is delivered, reinforce respect for autonomy, and contribute to reducing inequalities. And for this mission, ethics is not just a value or an abstract principle, it becomes a method. By listening to people's voices, professionals are invited to think critically about their own practice and to constantly improve them. So that's it for the HS. Thank you.
Thank you. And I will continue with the question how, and by describing how we work with ethical aspects at SBU. So next slide, please. SBU stands for the Swedish Agency for Health Technology Assessment and Assessment of Social Services, which you probably already know. And SBU is tasked by the Swedish government with assessing interventions in healthcare and in social services from a broad perspective, including medical, economic, and ethical and social aspects. So ethical aspects is included in our mandate. We have to do something, at least something. And this picture is just to show that SBU has worked much longer with healthcare interventions compared to social work interventions. We started with healthcare interventions already at the foundation of SBU in 1989, and later we received also dental care and work environment in our mandate, and in 2015 we also social services was also included in the mandate. So we have the ethics approach has evolved from work with the healthcare intervention assessment. But in 2014, an ethical framework for healthcare interventions was developed in order to help to do the work in a more structured way. But since we also have received social services in our mandate, another framework that focused on social interventions assessments was developed in 2019. And these two frameworks are quite similar and they share the same basis or core, but they also differ in some aspects. And the framework for healthcare has been published in an international journal. You saw the reference there in the bottom of the last slide. So ethical aspects should ideally be involved throughout the HTA or the SIA process. I will use the abbreviation SIA here. And for example, when you prioritize areas of assessment and when formulating the specific research question or scope of the assessment, it can be argued that social care interventions should be assessed, for example, on their ability to improve life opportunities and create conditions for independence and self-determination, and to identify or remove barrier to social participation. And these aspects could be integrated in the PICO or in the, if you use another framework for framing your research question. And it could be evaluated with quantitative or qualitative methods. But according to the SBU approach, we also believe that it is important to identify and discuss ethical aspects that are associated to the use of the intervention and in relation to the assessed effects and costs or health economics results if you have included a health economy analysis in your review. And it is mainly in the third step that we use the framework as support. So next slide, please. So this framework consists of different themes with supporting questions for each theme. And the first theme regards how the intervention relates to the goals that are specified in the social services legislation in Sweden. And the second theme deals with core ethical values and principles. And you see the examples of the questions in the framework that are within the second theme. The questions regards equality and justice. Does the intervention support people's opportunity to equal living conditions? Is there a risk that the intervention may lead to discrimination or stigmatization? And autonomy, do users have the opportunity to influence decisions about the intervention and its content? And we also have a question regarding integrity and responsibility. And then we also have a theme, the third theme here in this picture at least, is the organizational and resource related aspects. And here you can discuss issues that relates to costs and health economic results, but also organizational problems. And then we have also some questions regarding special interests and attitudes that may affect the use of the intervention. And then we also have some question that regards research ethics related to the included studies in your review, or that relates to problems that may be present for that is relevant to consider for the future research. And then lastly, we also have a question regarding possible ethical long-term effects. And some examples are can be, it can be, for example, environmental issues or how trust in social services authorities may be affected by the use of the intervention. Next slide, please. And the work process that we suggest when you use the ethical frameworks is that first you should have a preliminary discussion within the project group in order to identify spontaneous issues. And then you should go through the framework and discuss with support of the questions in the framework. And then we have some steps that are optional, and if you do them or not depends on the subject and the nature of the assessment, but also on time and resources. And that is a literature search, where you search for ethics literature that may be relevant. And we also have a step regarding consultation of relevant stakeholders. That may be users or professionals. It's quite often that we consult users of or receivers of the intervention within the ethics discussions. And you may also consider to do a deeper analysis or in-depth discussions with involvement of professional ethicists. And that is also quite common that we recruit as ethicists to our specific projects, but not always. And lastly, you should summarize the relevant ethical aspects that you have identified in a structured way to the final report, and we do that in a specific chapter, the ethics chapter. Thank you. Next. I think that we can skip this slide, so you can take next. Yes, we have to give you some idea what kind of ethical aspects that are highlighted in our reports. I have extracted some quotes from the summary of the ethics chapter of 2 reports, and this is translated from Swedish and in a very condensed form, so it might not represent the original concepts perfectly, but at least it's a hint of what kind of issues that we raise. And I should also say that both examples are from projects that mainly targets interventions in the healthcare, but are also relevant for social services. So the first report is a report on interventions for adults with co-occurring addictive and psychiatric disorders. And some examples of the ethical aspects that were discussed in this report were that it is essential to consider the living conditions of the target group alongside the broader societal and healthcare system factors. And it was also discussed that stigmatization and discrimination are pervasive challenges faced daily by many individuals, and that what that could mean for the use of the interventions. And there was also discussion around ethical issues arising at the intersection of the user's needs, evidence-based knowledge, and the interventions provided. And lastly, the authors concluded that research in this area involves several ethically significant concerns, often related to the vulnerable position of the individuals with dual diagnosis. And of course, the original reports have a deeper discussion around these issues. So next slide, please. So the next example is from a report on psychological and psychosocial interventions for children aged 7 years or younger who have been exposed to sexual violence. And in this report, there were not so much evidence from the results, the effects results of the systematic review, but instead the ethical discussion took a larger part in the in the report and also in the communication of the conclusions, the ethical aspects were highlighted. So examples of the ethical aspects that were discussed were, although the report shows that there is a lack of scientific knowledge for the interventions, there are risks in not providing support and treatment for the children. And to the extent that younger children have autonomy, it is limited, as they may have difficulties with understanding, reasoning, and making decisions. So it was a discussion around this. And it was also concluded that parents to children who have been exposed to sexual violence can be obstacles to children for receiving treatment. And lastly, there are strong ethical and scientific reasons for giving young children the opportunity to participate in research studies as active research subjects, this project group concluded. So next slide, please. Yeah, I think that was all from me. I have included some links here to the website of SPU. Unfortunately, we do not translate all the ethical discussions into English. Most are only available in full text in Swedish. But the links there, one goes to the framework for healthcare interventions that is translated to English, and the other link is to the framework for social interventions, and that is unfortunately only available in Swedish currently. And there's also an article about tracing treatments on an ethical roadmap that you can read if you're interested to hear more about how we work at SPU. Thank you. And now I hand over to Karin.
Thank you, Karin. So now I'm going to tell you about the approach that we have at INESSS. It's a global value appraisal approach founded on an ethics-based framework. So now we're moving from a specific framework to a global framework which uses ethics principles. And why do we have such a global framework based on ethics? Is because, well, our mission is fundamentally ethically embedded, notably with our vision, which is to produce a tangible impact on collective well-being. And we have a number of values enunciated in our founding law that call for equity, integrity, transparency, excellence. So all these values are ethically embedded. Okay, sorry. We have a statement of principles and ethical foundations. I'm sorry, I mixed up. I thought maybe there was another slide before. So this framework helps us promote consistency in the overall approach of our appraisal and the harmonization of how we do our assessments. And it helps us aim for a fair and reasonable recommendations to create value for Quebec society. It's based on 5 different dimensions, and the ethical aspects or considerations are transversal to all these dimensions. And it's how we look at each dimension and how we treat the elements within these dimensions that allows us to get out all these ethical considerations. So if we look at the clinical dimension, we will place our look on what are the impacts for the patients and for their family. If we look at the populational dimension, we look is the integration of the intervention possibly can have an impact on equity or distribution in the different population. When we look at the organizational dimension, we're looking at how are the people or the establishment that are going to have to use the intervention fit? But like, do we need to offer them specific consideration to help them? Is it aligned with their work? When we look at the social cultural dimension, we're looking at, is the intervention aligned with the social values of Quebec society? And for the economic dimension, we're looking at what burden it's going to put on the whole system, and is this going to have an impact on other health care distribution that we can have for the populations. So there are 5 steps in our global appraisal framework, and in each step we can use or integrate ethical ways or look out in our work. So if the first principle is the one where we look at the relevance of the intervention, so make sure that we actually have social goal within with the intervention that we're looking at, and that it is going to be or potentially bringing value to the population. And then in the second principle, where we mobilize the knowledge needed to do the assessment, well, we make sure that we include the ethical aspects in the literature review if they are pertinent to the assessment. We also promote the responsible scientific conduct of the people doing the work, so that they use all the knowledge gained or collected in a proper way. We also have consultation with different types of expertise, patients that we triangulate to come through a good knowledge of the intervention that we're assessing. In the third principle, we're doing the deliberations. For this, we do have to make sure that we include a diversity of perspectives to make sure that we cover all these considerations and that they come out. And in doing so, because we have so many different perspectives around the table, we have to make sure that we manage and balance the conflict of interest well, so there's not too much influence on the recommendations that we will be using. In the principle 4, we want to be able to formulate fair and reasonable recommendations, and for this, well, we need to be balancing the different opinions and mitigating the ethical tensions that have aroused and during our deliberation, and all of this in the aim of having a common good for the Quebec population. And then in the principle 5, when we're actually going through the implementation, well, we're not doing implementation, but the intervention will be implemented. Well, we have to make sure that we are meeting the intended social goal that were expressed in the first place, and that we are reaching the right population with this intervention. So what are the ethical foundations mobilized to do all this? We have competing ethical foundations that can be raised during all these stages. So we're looking strongly at integrity and responsibility, and but also like in theories like utilitarianism, where we wanted the greater good for the greater amount of people, and this can come into tension with human rights principles. Looking at different specific groups of the populations. We're mobilizing principles of distributive justice and aiming for equity. Also practical wisdom that we gain insight from all the people that collaborate in our work, and we apply considerations for populations in situation of vulnerability throughout the interventions that we are looking at. Different ways in which we are integrating ethical consideration in our processes are by adopting policies and guidelines to help our colleagues actually apply these principles. So we have some that are tied to managing conflict of interest, but also to mobilize the capacity to do responsible scientific conduct while conducting the assessment. And more recently, we also looked at how we can use AI responsibly in our work. We also build tools that aim to offer starting ground for doing the ethical analysis in our work. One of them is on equitable access issues that can be raised when we're looking at an intervention. We also have a community of practice in ethics, and this recently came out with a tool to help address sensible questions or ethical sensitivity in our work. So for all the different intervention that can raise sensible issues for the people that will be using them. We also offer collaboration and support within the work to make sure that this ethical analysis can be undertaken. I have 3 examples. Well, some of them we offer our expertise, and one example was done during the COVID pandemics, where we were looking at the population, vulnerable population, how they complied to sanitary measures. So the full framework on which the analysis was made is ethically based. We also sometimes help develop tools for the implementation of the intervention. One example is a tool for patients to be allowed to have informed treatment choices for depression during pregnancy. We also lead some collaborative work, which are founded on ethical reflections. Like we have this horizon scanning on integration of ethical considerations concerning social innovation in home care. So those are some examples of what we have done with our colleagues. I don't know, there's some slides skipped from my presentation. I want to say that ethics is embedded in the full structure of INESSS also. So we have ethicists and citizens on most of the consultation that we do. We have and on the boards and committees, permanent committees that we have as well. And something very particular to social services intervention and assessment is that we have this citizen panel as well, which can address some of the interventions that are being assessed. So very much embedded in our practices. I think that's it. Thank you.
Thank you.
I will keep on going with
yes, I think
the
so.
challenges.
Please.
So integrating ethics in social services intervention assessment can be complicated. Some of the challenges that we meet are the lack of resources or the missing competencies, because ethics is out of the expertise of most of our colleagues. Also, there's the necessity to adopt a simple and common ethics vocabulary to support the development of the awareness among the colleagues that we have. Developing an ethical argument requires nuances and making explicit the limits and uncertainties, which can be troubling. And sometimes when we're looking for solid, robust answers to the questions that we're asking, it can take some time. So when there's time constraint, it is something that our colleagues might not want to include in their work. And there's also always the risk of being instrumentalized to justify some of the recommendations. So we have to be very careful that what we're bringing to our work is integrated properly. But happily, there are ways forward to this. So we think that fostering an ethics culture within the organizations by increasing awareness amongst the colleagues, or building tools to support the analysis and explicit and transparent discussions of ethical issues can help. Also, it can be helpful to evaluate the impact of ethical issues in order to adopt a proportional approach for their integration within our appraisal. So it's not always easy, but if it's not necessary, maybe we can have less ethical integration in the appraisal. It would be good to have enough spaces and time to open discussions about ethics. This can help raise awareness among the colleagues, and it's helpful to have to embed ethical analysis within a regular appraisal process as well. So we'll be happy to answer your questions, but before we have another Mentimeter question for you.